All right, so this slide, we're going to talk about the movements of the condyle and the disc. Now, if you remember, there are two compartments. That disc separates the TMJ into two compartments, an upper compartment and a lower compartment. And you can see over here, the disc is right here, okay? And then above that disc is a compartment, and there's bone above that. And below that disc, there's a compartment. And the condyle is below the disc. So there's the lower compartment just below the disc, and the upper compartment is above the disc. So what we're going to talk about is we're going to talk about two movements. We're talking about rotation and translation, okay? Rotation is what the condyle does, and it only is within the lower compartment. And so when that jaw opens, the very first 20 to 27 millimeters of opening, that condyle is going to rotate within that lower compartment. And we'll kind of show you here. So this rotation is going to happen. That condyle is just going to rotate right within the compartment, but the disc is going to stay in place. So you watch that as it rotates like that within that lower compartment. That is, we'll show that again, right? That disc rotates right in that lower compartment, and that's the rotation. And that only happens between the first 20 or 27 millimeters of opening. Translation, on the other hand, translation occurs when that condyle slides along the articular eminence and goes down along that slope of the articular eminence, all right? And so that happens mostly in the upper compartment. It drags the disc along with it, along the slope of the articular eminence, drags that disc along. It widens the posterior compartment, and it makes the anterior compartment a bit smaller, okay? So the sliding of the condyle down along the articular eminence like that brings the disc along with it, changes the shape of that anterior and posterior compartment, but it's not rotation in there, it's translation along the articular eminence, okay? And that occurs in the upper compartment, and that's the movement that occurs after the first 20 to 27 millimeters. Now, to show you, skull lung, to show you how the mandible actually opens when it goes down the articular eminence. All right, as you can see here, here's the mandibular fossa, and then here is the articular eminence with the slope that goes down to the articular eminence here. Well, as the jaw is closed, it can rotate in the first 20 or 27 millimeters. But then if that condyle, and it's not ideal right here, but then if that condyle slides down the articular eminence like that, you can see, if you use your imagination a little bit, but you can see how that mandible will open as it slides down. It pushes that condyle down, and by pushing the condyle down, the whole mandible will open, okay? So as it slides down, the mandible is going to open. And you can grab your skulls and take a look at it and verify for yourself that that actually does happen.